Hey everyone, it's Dave with Action Onsite. Today we're going to talk about your transverse abdominis muscle and how it supports your lumbar spine. The transverse abdominis is the innermost abdominal muscle. It doesn't respond to normal muscle activity like sit-ups or crunches or any of the other typical leg exercises, but it does respond very well to some breathing techniques, and that's what we're going to talk about today. As we discuss the transverse abdominis, I want you to think about a cummerbund like what a man would wear with a tuxedo. Very similar in placement. The transverse abdominis is actually throughout the whole abdominal area. Works much the same way as a television antenna with guy wires. If they don't have the guy wires out there, they just fall over. Kind of like this tower. I take this and this and this and this and put it on there, it's going to fall. But if I build it all up and then use an appropriate guy wire to hold it all in place, it's much more stable. Anyway, so in order to do the exercises to get the guy wire or the transverse abdominis to work, we have to do some breathing. And the breathing is really simple. It's pursed lip breathing. This is the same technique that a lot of people with breathing abnormalities might use, COPD, other types of things, but it's a really good way to get the TA muscle to fire up. So when you breathe, I want you to imagine that you're exhaling through a coffee straw. Very simple. So you're going to take a deep breath in and then exhale. You get the idea. You don't need the coffee straw. That's just a prop. You can also do pursed lip breathing, which is just like this. So kind of like a duck face, but a little bit more functional and healthy. The breathing exercise is a great way to fire up the muscle to find out where it is and how to utilize it. You can also strengthen it up a little bit with the training. The most important thing to remember is that when you are lifting, to engage the transverse abdominis. This means we're going to fire it up so it's supporting the spine and giving a lot of good support to the back. So a couple ways you can do that. When you go to lift something, you can anticipate the lift. As you set it up, take a deep breath in, and then as you perform the lift, exhale during the lift and making sure that you're doing good exhalation on the exertion. The other thing you can do is once you have trained the muscle up a little bit, you can fire the muscle up voluntarily and utilize it for the duration of the lift. This is especially important when you're doing heavy repetitive lifts or just getting something off the ground or just moving something that's heavy. You don't have to use the transverse abdominis technique when you're lifting, but I really recommend you try it. And again, you want to do the exhalation while you're doing the exertion. So take a deep breath in, lift, and transfer the weight. Real simple. I really recommend to a lot of the people that I work with to do these exercises, to do the breathing when you're watching TV at night. If a commercial comes on, try to do the breathing for the entire duration of the first commercial set. After that, try and continue to do it throughout the rest of the show and just work with it a little bit. You may notice that you do have some coughing after a couple repetitions of it. That's absolutely normal. That's just the pressure from the breathing exercise getting down into the lungs and opening up those expanses and expanding the alveoli and everything else. This is an absolutely great way to work on your lifting techniques, your lifting endurance, and your breathing all at the same time. There's a lot of benefits that go into TA breathing, and I really recommend you try it today.